Up in Noto, so a lot of folks will be keeping an eye on that forecast, Jeremy. Ensuring everyone in our community has the chance to live their healthiest life is the goal behind health equity. It's a renewed focus for state and federal health agencies and also for healthcare providers in Topeka. In tonight's To Your Health, we look at two new positions and a new effort at Stormont Vail working for a healthier community. Emerson Frazier says she's seen loved ones encounter barriers to health care. It's why she's embracing her role as Director of Health Equity and Policy at Stormont Vail.
I want to be a part of the solution, not only for the people that I love, but also for the community that I love too.
Stormont added the position a year ago. Since then, Frazier's been poring over data, spotting trends, figuring out what stands in the way of people becoming their healthiest selves.
We as a healthcare system are aiming to better understand where those barriers exist so that we can strategically place programs in those spaces to help those communities or any communities that are facing disparities.
Pieces of the puzzle are scattered among agencies. A Kansas Health Matters report shows among Kansans on Medicare, those who are Black had a 57% higher rate of preventable hospital stays in 2021. American Indians had a 22% higher rate. KDHE data shows Black infants are 2 times more likely to die than white infants in Kansas. And there's the COVID impact. While people who are Black make up 6.1% of the Kansas population, they comprised about 25% of COVID-related deaths. And people who are Hispanic or Latino were 8 times more likely to contract COVID. Frazier came across a study on a key tool used during COVID to spot those at risk for complications.
And one of the studies surfaced that pulse oximeters were not as effective on individuals who had more pigmentation in their skin. And therefore, healthcare providers were not able to identify issues and lower oxygen levels in those patients as they were with patients with less pigmentation or white patients.
Not all disparities stem from race or ethnicity.
You can also have disparities in socioeconomic outcomes, in gender identity, and sexual orientation, in language.
A survey in KDHE's Healthy Kansans 2030 report released last year found 34% of single mother households experience poverty, and 48.5% of Kansans went without care because of cost. Getting to the why to break down those barriers is where Dana Blint and their care transformation team come in.
Some people may not be able to afford their medication, so they're not going to pick it up, they're not going to take it. That's where we step in and try to figure out some financial assistance for those patients. They don't have food, they're going to pick something not so healthy to eat.
The care transformation team of RN care managers, social workers, and community resource reps are stationed in the Cotton O'Neill Clinic offices. They'll screen patients for social determinants of health and are proactive in connecting them with resources to address those needs.
Transportation is a huge issue in our community. It's not just as easy as seeing the doctor and then out the door you go.
Taking it to the next level, they say, will require better information. This week, Stormont launched the We Ask Because We Care campaign. It urges patients to opt in to answering those questions about their race and ethnic background. They stress the information is kept private and protected, but is important.
Data is the backbone of understanding disparities and understanding where we're making improvements and where the solutions that we thought would help aren't.
It's hoped new information can guide the care transformation teams and forge even deeper, more targeted community partnerships.
Trying to get our community to their optimal health. Everybody deserves it.
And if there's any person out there where I can make a difference to make their life 1% better, I'm going to do that every day, and that's why I show up.
Improving disparities in health and health outcomes and improving access to care are among the 4 priorities in KDHE's Healthy Kansans 2030 State Health Improvement Plan. I have links to a lot of that data, a lot of those studies on WIBW.com. A Topeka